Thank you for the opportunity to do the pitch and the kind invitation. My name is Isaac Cano. I'm a researcher at Hospital Clínic here in Barcelona, but also I'm the CEO of SurgeryFit, and it's a spin-off company of the hospital. And I want to share with you one of our flagship products, which is SurgeryFit, and it's all about helping hospitals on making possible that patients get ready for surgery. Just a little bit about Hospital Clínic, in case that you don't know. It's one of the tertiary care hospitals here in Catalonia. It's a world-leading hospital in clinical practice, but also in research and innovation. Our aim, being part of the hospital as a spin-off company, is to bring some of the most advanced research towards market, especially focus on digital health. And one of our first challenges was to digitalize and bring to the market SurgeryFit as a digital support for surgical prehabilitation of the patients. And but why are we doing this? It's because the amount or the impact, better said, of surgical complications is very important nowadays, regardless of the latest advances on the surgical procedures. And when we think globally, it is in fact considered the third global cause of mortality. Because of this, many years ago, our hospital was one of the leading institutions in thinking how this could be improved, and the main aim being to enhance as much as possible the functional capacity of patients before the surgery, such as the impact of the surgery should be kept within a functional threshold. But how we get this improvement in functional capacity? It's by the combination of three main pillars: exercise training and promotion of daily physical activity. This, of course, needs to go hand by hand with nutritional support, especially in patients that they are very sedentary and they start doing exercise. They need some complements. And also by introducing psychological support. These programs are really good, especially for high-risk surgeries. And in these kind of surgeries, having the capacity to cope with the stress associated to this process, it's very important. We spent a lot of time in the past within the hospital in generating evidence. So we were able to demonstrate that this kind of intervention is able to decrease up to 50% surgical complications. Patients are able to recover 2 times faster. And when we think in terms of 30 days readmission rates, we are enhancing a lot this health outcome. Because of this, we have been, in fact, recently recognized as a good practice by the OECD, and is promoting its implementation internationally. But what is SurgeryFit? It's a digital health platform that, on the one hand, helps surgical prehabilitation teams in the hospital that are typically composed by physiotherapists, nutritionists, psychologists, the anesthesiologists, the surgeons, to work together in a collaborative and coordinated manner and personalize this intervention to the needs of the patient. And on the other hand, what we are doing is helping patients to follow the program without the need to go so often to the hospital, so increase the adherence to the program, which is one of the main factors for the success of the intervention. And for that, we have developed a mobile application that is also thought to be very user-friendly, especially for the elderly, because one of the most important targets for this intervention. This is what I just said before. This is the recognition by OECD due to all of this clinical evidence, and this is helping us a lot on going to other hospitals internationally and offer them SurgeryFit as a tool to help them on implementing at scale surgical prehabilitation. We started by implementing pilots in different countries, especially in Germany, but we are also going to start some pilots in the second half of this year in Australia and Saudi Arabia. And this is helping us a lot to validate that the value that we offer with this digital tool it's well received by the hospitals. And that's all. I think I still have 10 seconds left. Thank you for your